like to thank all of you for attending and joining our webinar. The role of histopathology and histopathology of diagnosis and prognosis of an illness. I'm Malvika Kanara, the marketing executive at Leader Life Sciences, and we specialize in facilitating research, the research community with scientific solutions and enhance their productivity and make them more effective. It's my pleasure to introduce you to my co-host, Rahaf Alabed, who is the Innovation and Acquisition Specialist at Lead Life Sciences.
Thank you, Malvika. Good afternoon, everyone. I'm Rahaf Alabed, the Innovation Acquisition Specialist here at Leader Life Sciences. Firstly, let me start by saying that it is our pleasure to welcome you all to our webinar. And secondly, it's definitely an honor to be introducing you all to one of our speakers for today, Dr. Mohammed. Dr. Mohammed has contributed greatly to the scientific community through his research in neuroinflammation in St. Vincent's Hospital in Sydney, Australia. And now he's a part of the Medical Laboratory Sciences Department in the University of Sharjah in the UAE.
So next we have Alexander Benjamin. He's the key account manager and marketing manager at SLE. SLE has been pioneering in precision technology and histopathology since 1954 and has been instrumental in setting up pathology laboratories across the world. And he accounts for most he handles most of the marketing aspects and account management aspects in international markets. He'll be speaking to you today from a manufacturer perspective, and the technologies that will be that will make the life of a histopathologist more effective and automated. So.
And now we'll be moving towards the presentation section of the webinar. And before we start, I'd just like to convey that all attendees will be muted. However, we would definitely love to hear from you all throughout the session. So please leave your comments and thoughts in the chat box, and we'll definitely be interacting with you later on. So I shall hand the floor over to Alexander Benjamin.
So thank you very much, Malavika and Rahaf, for the introduction. It's true that today I'm going to talk to you from the perspective of the manufacturer and the technology provider in the field of histopathology. Of course, I'm not a doctor or a technician, but we have Dr. Mohammed for this reason here for us. So can we move to the presentation perfectly? So being a Greek myself, I always like to start this presentation by analyzing the word histopathology, because the word itself actually comes from the Greek language. So it consists of three different words. The first one is histos, which means tissue in Greek. The second one is pathos, which means suffering or any kind of suffering. And the abbreviation logia, which means generally the study of something when you add it in the end of a word. So collectively, these words describe the technique of analyzing the tissue of a living organism, or in our situation, most commonly of a human, in order to understand some pathological diseases that have caused some kind of abnormalities on the tissue. So we talk about a technique that literally saves lives, which is something very important to remember, especially ourselves, when we design this kind of equipment and when we equip labs with that. So as with everything in this life, things didn't start very fancy. So in the old days, in the process, you would see things happening by hand, or by any kind of old equipment as the ones you see in the photos. You know, on the left side, you can see the first cryostat that was actually a sleek cryostat and invented by the founder of the company. So even this wasn't there from the beginning. But moving throughout the years, you are going to find, more modern equipment, things that become more automated, more friendly for the users, and most importantly, more accurate for the patients, because as we said before, we talk about human lives, and this is very important. So, as manufacturers, we always wonder and we always think, where is the future of histopathology? It's certainly the advanced automation, smart connectivity throughout the devices, and with certain kind of software, enhanced safety for the users, of course, which is very important. Improved ergonomics, again, something very important for the users that work a lot of hours in the labs. Last but not least, maybe the most important, as I said before, higher accuracy for the diagnosis and finally the prognosis for the patients. So, moving on, something that we always keep in mind while we design our equipment and while we design the next things that coming up is that histopathology has to be for the people. And when I say that, I mean we always want to have happy lab technicians in the labs, that they can do their job easier, therefore with less fatigue, and this will cause them to be healthier, but also to be more accurate. Successful diagnosis, of course. We want to get the most of the examinations that are happening in the labs. This, of course, leads to accurate prognosis, because if diagnosis is successful, then the prognosis is accurate. And as I said before, you will hear me to say this thing many times: healthy patients. Everything happens for this reason. So this was from my side. Thank you very much. I will be happy to answer any questions and discuss any other topics following up. Now, I think we have to move to the most important person in this talk, Dr. Mohammed, who has to give us great impact for the process itself. Thank you very much.
Absolutely. That was a great, insightful look into the world of histopathology, Alex. Thank you so much for taking us through that. And as he mentioned, yes, now we'll be moving to the important aspect, which is the end user aspect of histopathology. And I'd like to hand over the floor to Mohammed for giving his view on the same.
Thank you, Malavika. Thank you, Alexander, for the beginning and the introduction of the portfolio of success in the field. So here I'm going to talk about the histopath techniques. I will go through the histopath techniques, what is meant by histopath techniques, and how histopath techniques serve the diagnosis and also help in the process of clinical diagnosis. So usually throughout my experience of about 10 years in this field of histopath techniques and teaching students all the time to highlight the importance of this field to my students, I usually start my lectures or my laboratories with an inspiring story that happened to me personally, that my mom has been into some kind of cancer that's hitting the cartilage and the bone in the hip area. And those days, the only treatment known is the amputation. Luckily, the surgeon was up to date and he asked for a cryostat to be done. He sent the sample within maybe 15 to 20 minutes, returned back that there is no metastasis to the muscles around the bone. So he could remove the area of the bone that was affected, and that was ending with no amputation, which would really affected the life of my mom from that time till now, which is really reflecting on all patients under the operation, or even before the diagnosis, or even before getting the therapy. The histopathological techniques play an important role in this area. So here, just I'm going to just go through these. What are histopath techniques? What are the aspects of the histopath techniques? Now, if we look at the histopath techniques, as Alexander mentioned, that it's dealing with tissues, and these tissues they obtained from patients, and these tissues they are processed into a way that they will be suitable to be viewed by the people who are going to do the diagnosis, mainly the clinicians or the pathologists. Based on this one, they will get into a diagnosis. Based on this diagnosis, then there will be a treatment or a protocol. This is making a difference a lot for the patient. And in principle, if we want really to identify the tissue processing, is bringing the tissue that's obtained in an operation or anyway like biopsy into a medium that it will support it for sectioning. So we are working on preparing the tissue in different steps to place it into that medium and make it possible to get very thin sections and load them into the slides to do staining, and then we will be able to visualize them. Throughout all of this process, we need to maintain the tissue to be as normal as we obtain it. The tissue might be abnormal for sure, but we need the tissue to be as similar as the status that we obtain. For this, we make sure that the tissue passes through different steps. These steps, they are optimized through progress of many, many years. And recalling that the science of histology or histopathology is one of the well-established sciences and one of the oldest ones, like that started in the 19th century. Some people talking maybe before that. In the 19th century, people, they started to get tissues, and they talking about the staining of different components. Till then, the discovery or the invention of the microscope by Leeuwenhoek and his colleagues later on, and improvements and so on. All of these, they allowed us to study these ones over the years. Over the years, there is improvement in this process. So we got now a routine protocols that allow us to process these tissues, different types of tissues, to get clear and precise diagnosis. Starting with the tissue collection, that's usually performed by the pathologist or the surgeon or the doctor, and these tissues need to be directly fixed into a suitable fixative, which usually we use buffered formalin or natural buffered formalin. In the lab, then these tissues, they undergo trimming, kind of, we trim these tissues to find out what are the areas in these tissues that they are of interest for later on examination under the microscope. Some tissues, they might be amputated organs or big organs. These ones, we need to only get small pieces of these ones and load them into the slides to examine them under the microscope. So here, the role of the pathologist as well, to determine what are the exact areas that they need examination. Otherwise, this can be an important area in the tissue can be missed out, and maybe a diagnosis can be also missed out based on this. Then after that, in a series of dehydration, the fixative is removed and then replaced by fixative, and water will be removed and replaced with alcohol to prepare it for next step, which will be the clearing and preparing the sections for the paraffin. For these steps, usually because there are many steps, we are talking about maybe 10 to 15 steps, depending on the tissue, depending on the protocol. It's tedious, too many reagents, too many changes, and even too many variables. So in the field, usually as everything becoming into a time of automation, we have nowadays automated processors where we can place the reagents inside the containers, and then the process of changing the tissues from one solution to another solution is computerized and automated precisely. Even though the modern processors, they check for the expiry date and the levels of the solution, and they alert the technicians about this kind of thing to be changed or to be addressed. Having that, the tissues, they are prepared and they are embedded in paraffin, giving them a suitable media that will support them, then we are okay to section these ones using the microtomes. In the microtome, what is happening is those blocks that they were placed in paraffin, now they are kind of supported in order to get thin sections up to maybe 5 to 10 micrometer thickness, which will make them very suitable to be stained later on and to be ready for examination by the pathologist. So throughout this process, these tissues, they are prepared carefully. Many conditions, many factors, many variables, they need to be checked at every step, because every mistake can result in a kind of variation in the tissue later on. These ones, they can be detected, yes. They can be addressed, yes. Maybe if we are lucky and we have enough amount of tissue, we can return back, but sometimes the tissues, they are very precious. So it's only one-time shot. This is kind of very important to be going through a well-defined protocol, well-optimized protocol. Usually in the labs now, people, they prefer automation because it's standardized and the process is done without any variables. So now, as we are in the 21st century histopathology, you can realize that this is not only a work of one technician, it's a teamwork. There is the pathologist, there is the pathologist, the resident pathologist who is doing the trimming. There is the technician who is, along with the pathologist, determines how is the tissue is going to be oriented in the cassettes. Also, there is the technician who is overseeing the process of the preparation. Then after that, there is the staining and all of these processes, which is need to be really looked to carefully. Moving to currently the era of personalized medicine, where we now achieving a degree of knowledge that we are making a personalized diagnosis per a patient. For example, per a cancer patient. All of us, we know that cancers, there are many cancers. Each patient, they got their own different kind of cancer with different kind of mutations. These ones now getting into personalized medicine, where we need to find the diagnosis at the cell level, and we need to design or get the medications that's suitable for that kind of cancer or that pathology. Also at the level of molecular diagnostics, we are looking at the mutations, at the problems in the RNA expression, problems in the protein, all of these things, they are evolving a lot and they are changing daily. So this science, since the beginnings, more than 100 years ago, it never been the same. Every day there is changes, even the patients, they are changing, the diagnosis is changeable. All of this kind of thing is providing with a cumulative kind of this is just an overview about the histopathology, and thank you very much for your joining and listening. Thank you, Leader Life Sciences, for bringing this up. It's an important issue and people, they need to be aware about it. Thank you guys, and all happy for the discussion.
Absolutely, absolutely, Dr. Muhammad. Thank you so much for the presentation. It was definitely an amazing refresher for the histopathology process. And also allow me to sincerely thank you for sharing your story of how your mother's diagnosis with the help of a cryostat actually drove you to develop an interest in histopathology and eventually being a part of this industry and sector. And interestingly, the first cryostat, since you've mentioned in your story that it was involved in the quick diagnosis or the emergency diagnosis that happened. So the first cryostat ever developed was actually developed by the founder of SLE, Kenneth SLE, in 1954. So it's definitely a beautiful synergy that we have here in this webinar. So yeah, again, thank you so much for this presentation. And now our speakers are going to have a discussion addressing how histopathology affects diagnosis and prognosis of an illness. Let's look at the first discussion point. So from a manufacturer's point of view, Alex, how do you think reaching a successful diagnosis at a lab, how do you think the technology, of course, the technology really contributes to reaching a successful diagnosis, but what are the different gaps to be addressed that you think technology can fulfill?
So yes, thank you for this nice question. This is always an interesting topic about, from the manufacturer's perspective, how we enhance productivity in the labs, how we enhance the accuracy of the process. So the answer from our side is always going to be technology. But technology by itself cannot solve all the problems, not until today, to be honest, unless there's a crazy hidden project that I'm not aware of. So until today, what we try to do is to find the perfect balance. So to introduce as much of technology as it is possible in the process, but still use the human experience and the human knowledge throughout the process to get the best result. So unfortunately, until today, it's not possible, or fortunately, maybe, this is a big discussion, big long discussion. Technology cannot do everything. So there are sensitive processes throughout the process itself, like the part of the orientation during embedding, or the orientation during sectioning, because this is a very important part. We usually talk about sections, how easy they are made, or how fast can we make them, but sometimes we forget the most important part, which is accuracy. If we don't have accuracy throughout the process, then the fast result has no meaning. So this is why we try to introduce the most advanced technologies and the most of the automation that we can throughout the process to make the life of the users in the labs easier and the outcomes faster. But on the same time, we test thoroughly every technology in order to be sure that we have the best result. And this is where the experience of a histopathology or a histotechnician comes in, and with combination with the technology that we provide, give out the very good result and the correct diagnosis.
Thank you, Alex, for your answer. It was quite insightful to hear from manufacturer's point of view. And now I will address the same question to Dr. Muhammad. So Dr. Muhammad, how do you think, what are the different aspects in your opinion, that should be emphasized upon and are super significant when it comes to reaching a successful diagnosis in a laboratory?
Yes, it can accept automation at certain stages, which is the processing of the tissue, but the human factor is needed there. You can't get the robot, for example, to decide during the operation which is the tissue that need to be processed later on. Maybe now people, as Alex mentioned, maybe they are working on artificial intelligence kind of algorithms. So far, up to our knowledge, there is nothing would replace the human factor, especially in getting the biopsies, in trimming the tissues, determining which is the area of the tissue that needs to be processed, the orientation, even the testing of the slides after staining, determining whether these are good slides or bad slides. Definitely, it will need the human factor. So I'm kind of against people who are mentioning, even like in the medical laboratory field, that automation now going to replace us, we're going to be obsolete. No, it's not yet. So it might be maybe in some other sessions, like in the sections of the lab, like clinical chemistry, where there's huge stations that they process samples from A to Z, but this is not going to happen at least in the near future. So definitely, I agree with Alex on the need of human factor, but also I need to add that the instrumentation itself needs to address the precision of the process. For example, if we come to the microtome is required to produce consistent thickness of the sections. Sections with maybe just consistently 3 micrometers thickness. You don't want to have, for example, a section that is maybe half 5 microliter and half 10 microliters, or maybe alternatively, one section is thick, one section is thin. So here comes the automation or the machine ability to support this process and make it easy. The same for the staining. In the staining, definitely the staining, by the way, is tricky, because dealing with the stains means that you need to look for the age of the stain, the expiry of the stain, the preparation, whether there is dehydration, oxidation, and many other factors for the staining. In my opinion, automation of the staining process is one of the successful things that happened in this field, because when you're dealing with a standard procedure that's happening apart of many other variables, this really makes the output of the slides more consistent and more easy for making the diagnosis later on, and reducing the time to return back and generate newer sections. Imagine that a patient waiting for a diagnosis or a decision for the treatment. The process might take from taking the biopsy to getting the diagnosis 2 to 5 days, depending on the setup. Sometimes, if there is a problem, you need to again do it again, which means that another 2 to 5 days. It's a prolonging the process. So here, the automation is very important, and definitely the manufacturers they really appreciate this kind of thing, and they're looking into it precisely to be sure that these instruments they are going to produce standardized kind of output.
Absolutely, absolutely. I completely agree with you, Dr. Mohammed, and thank you for your answer. So the next discussion point is quite interesting, and it would be great to hear it from you as a scholar. It's quite known that during undergrad, or when developing the skills in histopathological techniques in general, manual models of the histopathology equipment is preferred to teach students, so that they would be able to, of course, know the foundation and the basis. But now that the world is moving towards an automation, an automated laboratory, do you think that it might be more important now? The importance has increased for tomorrow's histopathologists to learn on automation technology, or would it still be like a team manual equipment?
Really, personally, I prefer to get the students through the manual part first, to get into all of the hectic things that related to the manual part, and also to get into those problems that they might encounter, the troubleshooting, how they do it. Once they master these ones, it will be easy for them to appreciate the importance of automation. And you know, the appreciating things come from really experiencing the hard thing. And also, not all of the setups really in the hospitals have the luxury of automation. They might not afford to get maybe automated processor. So this thing really makes definite for the students to start with the traditional or the methods that they are before the automation, and then after that they introduce to the automation. For example, we have labs that are addressing the tissue processing the old-fashioned way, and then after that we introduce them to the automated processor and how it's working and what they are using. We got it there and they see it, how it's working. Now they are mastering both things. The same for microtome. They do with the manual microtome, and then they try the automated microtome, and so on. This way, they just mastering both things, covering all of the areas or all of the labs that are going to go into. And all the time, you are really not guaranteed that you will have what you wear.
Absolutely. I definitely understand your point, and dealing with manual equipment first, definitely, like from my personal experience, definitely taught me a lot. I didn't even know that there were automated microtomes and automated stainers. We had to go through the whole process, which kind of makes it stick to your head. So I definitely I agree with you. But I would like to also give Alex the same question. So since SLE is a pioneer at manufacturing automated histopathology technology, do you think, do you have a different point of view that you can shed light onto?
Well, to be honest with you, I'm more or less in the same side with Dr. Mohammed. I do believe that a good balance is the answer to your question. So, in my opinion, it's good that students get the chance to work manually so that they understand in depth the process itself. But then also is good, of course, when it is possible, to get in touch with the last word of technology, to use technology, to know how to utilize technology to achieve a faster or better result and get trained for the real world. Of course, we always need to get into consideration, speaking about different countries or different markets, that what is the actual situation in the labs. Because there are markets that like possibly is United Emirates, that everything is automated. You see high levels of technology, but there are other markets that some things, even in actual labs, still going on manually. You still have to do things in a more primitive way. So for this reason, the best possible to do is to have people train in both techniques, have them deeply understand the techniques, and then give them the opportunity to also get trained in technology.
Absolutely. So I'd just like to add that we had a small poll for our audience as well right now, where 78% of them had said that we need to have automation during the education level itself. So I think a lot of them are siding with Alexander on this one. So yeah, okay. So let's move on to the next point, which would be, what are the gaps that you think needs to be addressed for, to address the increasing cases that has coming in terms of in terms of diagnosis and prognosis. So from a manufacturer perspective, what do you think, Alexander?
Right. So the biggest challenge that we need to face is to take the process one level forward. So at the moment, we have made the most of the available technology. Of course, you still see improvements in the throughput of the instruments, or some things get more automated, some processes get more automated. But we need to use more and more the software and tools like the AI that Dr. Mohammed referred before. These are things that we need to introduce. But the point is that every new technology needs a level of development, which is normally long, because you need to develop a new technology, first of all, to get the new concept, then to develop this technology up to the point that it's efficient and it gives a proper result, a consistent result, which is also important. And then you need to reach to the level that you make it commercially available. So in business terms, this means that you can produce this product in mass production, and then you can also offer it in a price that it's logical for the market. Because we can't provide a microtome that costs like $1 million or something. This is not something that it's ready to be commercialized. But I'm sure that the market works towards this way. Of course, in any way, as much automation as you want to introduce, keep in mind that in the end of the day, it's human that that have to program and to get into consideration all the aspects that need to be taken care of. So in any way, you can exclude the human from this process, but you have to give them the tools to do their job faster and more accurately. And given the chance, I would also like to answer a nice question that I saw from the general chat. Mr. Mohammed Al-Sahar asked if manufacturers can include software similar to facial recognition techniques for tissue recognition, and maybe this helps to the orientation during embedding or during trimming. Interesting topic. Like your question, it takes a lot of discussion from the point of manufacturer. Things are not as simple as they look, because first of all, you have to do with a big diversification of the cases. It's not as simple as to recognize a face, which can also be challenging, but at least you have some standards that you follow. Speaking about one species, which is human, and a general construction of the face, which is 2 eyes here, 1 nose, and 1 mouth here. Also, you have to take into consideration that you talk about instruments that get dirty. So you have to take this into consideration when you place sensors into place, etc. And then you have to be 100% sure that what you have developed works perfectly 100%, or at least 99.9% of the cases. Because if you lose diagnosis in 3 or 5 specimens, you put 3 or 5 lives into danger. It's not as simple as you lose the face recognition of your phone, then you cannot unlock it, but then you have a password that you can use alternatively, or you can just go to the manufacturer and ask for a different phone or for a better sensor. This is human lives in the line, and we have to be very careful for every new technology that we introduce. consistency is maybe even more important than the outcome.
Absolutely. So yeah, so it has to be a slow, gradual process where, you achieve things in a consistent manner than, a faster manner. So it's more of effective than quicker sort of thing. So I propose the same question to you, Mohammed, as well. So, well, what do you feel are the gaps from a user perspective that, might make things move faster, the diagnosis move faster, the prognosis be more accurate?
I would really refer to this on what Alex was mentioning. And this is like from experience, only like within maybe previous 4 years, I was following up the companies that they are producing artificial intelligence, identifying the blood films and the bone marrow spheres. Starting from maybe about 5 years ago, these programs, they were only to
I'm
identify
sorry,
about,
Mohammed,
yeah,
your voice is breaking up a little bit.
is it
So,
is it now okay?
yeah, this is perfect.
Yeah. Okay. So like as example in the area of blood films and the hematopathology, diagnosis of the abnormal blood cells. At the beginning, these algorithms or artificial intelligence was only able to identify normal white blood cells. Last year, only in the mid lab in Dubai, for example, I came through systems that they were able to take an image of each or every single cell in the blood film and profile it alone in an image, quantifying all of these cells, flagging the abnormal cells, all of these ones through scanning all of the blood film, which is really a huge change within few years. Would be the same maybe happening for the identification of the sections that's in the pathology field. Honestly, I haven't come through this one so far. This is one side. This is in the automation. Also, the process of diagnosis can be also improved through improving the interaction or the communication. I was part of a presentation that being delivered by a Brazilian pathologist. That was like in 2015. I wasn't. He introduced a successful story on how the pathologists in Brazil, where they are suffering from the very few number of pathologists, to overcome the huge amount of the diagnosis through making up a mobile application that's connecting the remote labs when they achieve the slides, staining and being ready with a low-cost cameras attached to the microscope. They take the photos and then they share them on the mobile phone application, allowing for the diagnosis that's remotely without maybe sending the slides from one city to another city, which taking longer time, or the pathologist have to travel from one hospital to another hospital. And he was talking about now big network that's covering Brazil. These things maybe also need to be looked at in the terms of improving the process of the diagnosis and accelerating the process. Maybe the tissue processing itself is well developed and well mature process in terms we can't really cut it in the conventional histopathology, putting aside the cryostat, which is like kind of a special case. But we can think about innovative areas that can be improved in this context for sure.
Absolutely. That's a great look into the whole idea of this thing. So unfortunately, we have to come and end to the discussion right now. We'll move on to a question and answer session, and we'll take the questions from the audience right now.
I think we've already started with
absolutely.
a few questions.
Yes.
So I think we'll start with a question from Mr. Van Blasto, if I'm saying it correctly. So can the manufacturers try to produce a machine that does automatic staining? Alex, would you like to answer?
Mhm.
Well, I would say that there are already some solutions of automatic staining. This is something that we provide. I mean, today you pretty much don't have to do anything. You just enter the slides in the automatic stainer, and then you get them out stained. Maybe the question had to do about the whole process being automated, or maybe some auto combinations. I'm not sure, but staining today is actually automated. We have stainers, and from our perspective, we have also provided stainers that can be paired with your mobile phone, your tablet, so you can even attend the process from some distance. So you can even do some other things when the staining is happening. And something that we also try to do as much as possible in our instruments is taking care of the health and of the user, and of the fact that the user should be safe. So in every stainer that we provide, or in every tissue processor, you have systems that protect you from the fumes, exhaust systems passing through filters. So this is pretty much my answer. Staining, I would say that is pretty much automated already nowadays.
Absolutely. And then there's also another question directed to you, Alex. So regarding the accuracy mentioned in the beginning of the slide, does that involve the improvement of image resolution and recording, or were you referring to something else?
Can you rephrase somehow this question, because it's not really clear to me what you need?
So in the beginning of your slides, when you were talking about enhancing the accuracy of diagnosis and all of that, does that involve the improvement of the image resolution? I'm guessing they mean under a microscope, which is not really what we have discussed earlier. And is the whole process recorded?
Do you mean that the process is being recorded, the whole process that we do?
Like, do you think that the image resolution also plays an important role?
Sure. I mean, if I understand well what you mean, the resolution of the section itself in the end of the process is very important, and is determined from, how correctly the previous steps have been taken. I think this must be from Dr. Mohammed's presentation, but nevertheless, all the steps, and most importantly sectioning, but also staining and cover slippery will determine the outcome and the final resolution of the section under the microscope. So unfortunately, I cannot say more about microscopes, because we don't provide microscopes, but up to the point that the section will reach the microscope, it's really determined by every step in the process. So the tissue processing in the beginning, it has to be done correctly. So the orientation throughout embedding has to be correct in order to be able to section in a proper way the tissue. Then sectioning has to be done correctly, not to have shattered or bad quality sections. And then, of course, even staining has to happen correctly in order to have nice contrast on your tissue. And this is something that maybe in the old days
we kind of lost you, Alex. Your voice is breaking up.
Or maybe even manufacturers, actually, didn't put much weight. But nowadays, it's why I provide in order to do cover sleeping in the most proper way and to have the best of especially about labs, the digital pathology. Especially for digital pathology, the resolution and the cover sleeping has to be
done properly. Yes,
perfect.
absolutely agree with you. And these steps definitely, it's definitely important to get these steps right, so that the end result of the resolution reflects that as well. So, Dr. Muhammad, it's a very interesting question for you, and it was also a question that I wanted. I would love for you to answer it as well. So, Mr. Satosh would like to know more about the importance of histopathology diagnosis in the era of personalized or precision medicine.
Yes, thank you for the question. It's really good question, Santosh. In relation to this one, there were a story from a colleague who is a pathologist in Germany. They got that weird tumor in a younger, and they find out that at the beginning it does not responding to the treatment, the usual protocol that they use for that kind of cancer, which is, I think, it was a kind of liver-related cancer. So what they thought about is they took the biopsy and they sequenced the DNA for the mutations. They found that there is a mutation that also targeting a metabolic pathway in the liver. And based on that one, they tailored a protocol, a therapeutic protocol that targeted that kind of tumor, which was successful. It's one of the success story in this field. Now, when you come to this kind of personalized medicine or diagnosis in the histopathology, nowadays what we have is kind of microscopes that's equipped with laser scissors, where you can target certain areas in the section and maybe excise with the laser few cells, maybe single cell, that you feel that they are related to the pathology. And then these ones, they can be either go into single cell sequencing, like DNA sequencing, and then they can be checked for the mutation. This is what we have so far for the personalized medicine. It's just at the level of the cell, even in the paraffin-emitted sections, we can target these single abnormal cells, get them excised, and also process them to find out what are the molecular events that went wrong in
this. Thank you, Dr. Muhammad, for that answer. It's definitely enlightening. And yes, of course, it's great that you kind of bridged that pathway from histopathology to molecular. With the whole sequencing and all of that from a histopathology sample.
Yeah. So we'll have to wrap this up and make this the last question, and let's end on the futuristic note of precision medicine. So if you have any further questions, you can share it with us on our email address, marketing@leaderlifesciences.com. Thank you, Alexander and Dr. Mohammed, for taking the valuable time out of your schedule to come and give this very informative and insightful session. And it was really great to have you on board, both your presentations, the discussions, and the questions that answered. It was amazing. Thank you all for attending the webinar and for being a very active participants. And I hope you enjoyed this. Please follow us on our social media pages for knowing more what our upcoming marketing initiatives and webinars and other events. Thank you for joining all. Thank you, Rahaf, for co-hosting with me. And
thank you very much for having us today. It was really, really interesting.
definitely. Yeah.
Thank you.
Absolutely. Thank you, guys.
Thanks,
Thank you
thanks,
all.
Malavika. Thank you, Alex.
Have a nice day, all of you.
You too.
Thank you.
See you later. inshallah. See you.
Bye-bye.
See you.
Bye-bye.
Bye.